indications for interventional treatment of acute pulmonary embolism is any patient with suspected or proven pulmonary embolism, but also hemodynamic instability that is usually shown by echocardiography, transthoracic or transesophageal echocardiography, or CT pulmonary angiography. And what we see on these CT pulmonary angiography is that the increased pressure on the right ventricle could lead to a spiral of events, a downward spiral of events that lead to hemodynamic collapse and subsequent eventual death of the patient suffering from acute PE. Since we usually start with systemic therapy, indications to this systemic therapy or failed systemic therapy are a definite indication for catheter-directed thrombolysis in massive PE, and that's where the interventional radiologist comes into play. In my opinion, imaging plays a key role in the treatment algorithm. In acute PE, apart from the clinical decision rules, CT pulmonary angiography plays a major role in determining the optimal treatment strategy. Nowadays, CT pulmonary angiography is the main imaging modality, simply because it's able of demonstrating the presence and the extent of pulmonary embolism, but it could also help in finding an alternative diagnosis in those cases where patients are actually not suffering from pulmonary embolism. On the other hand, in those patients who do suffer from pulmonary embolism, it can also help us in showing us the signs of right ventricular obstruction by showing these as well on the pulmonary angiography CT. The IRs can assist the anesthesiologist and the perfusion technicians in setting up ECMO treatment. We can definitely help them in proper positioning of the arterial and venous catheters. But in our own field of expertise, we can use many techniques that help in removing the immediate risk for a patient, removing the risk of the RV pressure by, for instance, catheter-directed thrombolysis with or without ultrasound enhancement, or we could use thrombus fragmentation, where we use pigtail catheters, rotating pigtail catheters, to fragment the thrombus as much as possible. Or nowadays, and those are usually the latest techniques available, we can use aspiration or suction thrombectomy. Prevalence is such that, in my opinion, all interventional radiologists should be aware of the possible IR treatments, especially since these treatments are not so difficult to master and have a great benefit for the affected patient.